Hi everyone, welcome back. And once again, thank you very much for giving me a positive feedback for my previous videos, especially dating and relationship with a person with borderline personality disorder. That's BPD. For the last video, quite many of you had a question. Dr. Grover, if we can have some knowledge about difference between a person having a borderline personality disorder and ADHD because of impulsiveness and bipolar disorder. Therefore, my today's video will be about ADHD, and once again, before starting, I will say this is just for psychoeducation and not a substitute of your treatment or a therapeutic session. Please follow the mental health protocols and support for proper treatment plan according to your case from a mental health professional. The complete form of the word ADHD is attention deficit hyperactivity disorder. ADHD is a condition that affects people's behavior. People with ADHD can seem to have trouble in concentrating and act with impulsiveness. Symptoms of ADHD are mostly noticed in the early age and more noticeable when the child starts with school. Most of the cases are diagnosed when kids or children are under 12 years of age. Because of lack of neuropsychological testing or people not reaching out for formal diagnosis, sometimes ADHD may not be recognized when someone was a child and they are recognized later at adult age. In my clinic here, we do have certain valid and reliable tests which support us to diagnose adults with ADHD. The symptoms of ADHD may improve with age, but many adults do continue to experience problems because of lack of diagnosis or because left untreated. Research has identified number of possible differences with the brain of people with ADHD when compared with those without the condition. But don't forget, having ADHD does not mean that you're not smart enough, you're not intelligent enough. The reasons what the research says that people can have ADHD because of born prematurely, smoking or alcohol intake or drug use during pregnancy. Also, the main reason of a person having ADHD can be genetics and the neurotransmitters in the brain working differently than a person without ADHD. The symptoms of ADHD can be categorized in two types of behavioral problems: inattentiveness, that is, difficulty in concentrating and focusing, hyperactivity, and impulsiveness. Many people with ADHD have problems that fall into both these categories, but this is not always the case. Therefore, according to the DSM-5 or ICD-10, the Diagnostic Statistical Manual of Psychiatry, the three types of ADHD are attention deficit disorder, that is ADD, which is inattentiveness only, ADHD with hyperactivity and is termed as ADHD hyperactive impulsiveness type, combination of both the above, hyperactive and inattentiveness. Symptoms of inattentiveness impacting our cognitive skills are difficulty concentrating and focusing, having a short span of attention, being easily distracted, making careless mistakes, appearing to forget and losing things. You must have heard many of the patients with ADHD, they leave their keys, their car keys somewhere or their wallet somewhere and they forget about it. And then they are finding early in the morning before they go to work. Another symptom, very strong symptom, which a person or an adult with ADHD can have is to take time to start with a task. Therefore, procrastination comes in because people do not want to do tasks which are very time consuming and tough and boring. So they extend and they extend to start the task. They'll say, I'll do it after 1 hour. I will do after breakfast. I will do this weekend. It never happens. It takes a lot of time for them to gather themselves up to start the task. Another symptom is appearing to be unable to listen to or carry out instructions because most of the people with ADHD, they listen to half the instructions and then their mind goes somewhere else. And later on, they fill in the gaps which are there because they were not listening to the instructions properly. And they fill in those gaps maybe in a right way or a wrong way, finding hard to focus and complete the task in the way which is expected. Feeling restless or being impatient and filling in the step by step instructions, reading the other person's mind differently, leading to a gap in their mind with instructions or situational reactions can lead to work, personal relationship, and social issues, and in their own personal life. A very good example with a couple of my patients is that the supervisor or the manager is instructing you to do a certain thing or a task in a step by step way. But without listening to the complete instructions, you are running those steps in your own way and registering them in your mind in the own way. And then the work is not completed according to the way it was asked. But you are completing the work or the task according to the way you thought and were thinking when the supervisor was speaking. So the mind gap and the communication gap both come to a certain project or a piece of work leading to a serious work issue. Another example of my patients of ADHD impacting their personal life or relationship is that many of my patients, for example, they have to plan for a certain event, an important event, a wedding anniversary or celebration. One of the partner, they want the event with various things to be done to make it successful. But the other person has their own mindset and thinking the step by step way they want to plan that event. Both the parties are not at the same page because it is not mentioned on the paper and because it is not rehearsed that how the step by step event can be planned or organized. So this mismatch leads to unhappiness in a relationship and the event not going on in a good way. Another important symptom of ADHD is the carelessness and lack of attention to detail and inability to focus or prioritize what tasks need to be done first, especially managing the house or home chores. The issue starts in relationship between partners or living together. One of them, a very interesting case with most of my patients, is that they come to me in a family systemic approach with ADHD, and they report, Dr. Grover, she wants me to leave all the work, my entire planning, and wants me to start doing vacuum the carpet because some guests are suddenly visiting in the evening. I am not going to drop my entire plan, and I have my own timelines to do certain piece of work. And the other person and my wife or my partner doesn't want to wait, and she ends up doing the things on her own, which causes an issue. Out here, it's very clear. One of the strong symptom of ADHD, of not prioritizing the task or setting up priorities with certain timelines, impacts their personal life or their home life. Now we will come to some main signs or symptoms of hyperactivity or impulsiveness. Hyperactivity or impulsiveness is something which, when a person is unable to sit still, especially in calm or quiet surroundings, constantly fidgeting, excessive physical movement. You must have seen a person shaking their leg. It's pretty distracting. That is impulsiveness. And excessively talking, being unable to wait for their turn, whether in traffic or in a grocery store. And the one which is linked more to impulsiveness is acting without thinking or understanding the consequences. Mood swings with impulsiveness and risk taking capacity with no sense of danger is one of a specific symptom of ADHD, which confuses with the mood swings and impulsiveness with the patient with borderline personality disorder and mood swings of bipolar disorder. In case of bipolar disorder, it is a mental health condition that affects one's moods, which can swing from one extreme to another. But don't forget, in case of bipolar disorder, mood swings are not as quick as ADHD. They remain there for days together, 7 days or a week or more than that. And the maniac reaction is talking and talking, doing things, not sleeping. And then when they come back to the stage of being okay and not being maniac, they are not acting like a patient with ADHD. ADHD is not being maniac. But the impatiency and the mood swings and irritability is caused because of issues with cognitive skills. A very important point. Cognitive skills of concentration, focusing, memory, and problem solving, especially in stressful situations, are the reason of impulsiveness or irritability or mood swings with the patient with ADHD. It is not the way the neurotransmitters are working as with bipolar disorder. That is without any situation or environmental trigger or any cognitive skills being impacted first, the person has mood swings. When we look at maniac person, he's feeling very happy, have lots of energy, making plans and ideas. So cognitive skills get impacted by the mood, leading to a behavior of spending large amount of money or things you cannot afford, not feel like eating or sleeping, talking quickly. And when things don't come their way, they become annoyed easily. The only symptom here which overlaps with ADHD when we talk about risk taking activities, for example, driving dangerously and road rage, a very common behavior of both bipolar disorder and ADHD. In case of patient with ADHD, we say the cognitive skills are impacted. Cognitive skills are more the functions your brain uses to think, pay attention, to process information, including memory and problem solving. In case of bipolar disorder, these skills are impacted because of moods and emotions swinging high or low. So with ADHD, it's the other way around. The cognitive skills are impacting, leading to irritability and mood swings because of finding hard to handle the situation. In case of bipolar disorder, the mood swings are causing issues with cognitive skills, and person is finding hard to think and analyze and solve the problem. Now we will look at the patients with personality disorders as a differential diagnosis for ADHD. A patient with personality disorder, their conditions differs from average person in terms of how do they think, perceive, feel, or relate to others. Borderline personality disorder, don't forget, they have disturbed ways of thinking, impulsive behavior, and problems controlling their emotions because of intense but unstable relationships and imagined or perceived abandonment. In one of my previous videos, I have mentioned it's all about relationship, love, intimacy, being abandoned, insecurity, and being unstable. So, unstable relationships can or the one of the basic symptoms of borderline personality disorder. Relationships are the priority, and the person is a priority in case of borderline personality disorder. In case of ADHD, the feelings of being in love and relationships are not all that intense. Emotions are not all that intense, but the behavior is impulsive, which matches with the behavior of borderline personality disorder. And that is why we confuse both the diagnoses. Don't forget, in case of borderline personality disorder, emotions, lack of emotional regulation, they come first, and then the behavior of self harming and overreacting comes later. In case of ADHD, the emotions come later, behavior comes first, thinking comes later. Remember, we just talked about that acting out without thinking about the consequences. In case of borderline personality disorder, mostly emotions and thinking may come first and behavior comes later. Remember, in borderline personality disorder, I have discussed in one of the videos somewhere that a self harming behavior is to tell the other person that they are going through emotional pain. So the behavior comes later. In my practice, I have come across many of my patients who have combination of both ADHD and borderline personality disorder together. It is very hard sometimes to differentiate and to treat them because mindfulness and dialectical behavior therapy is the main treatment for borderline personality disorder with combination of cognitive behavior therapy, which I have discussed in my last video. But guess what? When the patient is with ADHD too, and they have impatience and lack of sitting back and calming themselves, especially in a calming scenario, it becomes very hard to support them with DBT and mindfulness technique. But still, basic mindfulness skills and the beginning of the meditation or mindfulness skills is a preferred treatment in the beginning, even for the people with ADHD, because it's a learning technique for them how to start with bare minimal 2 minutes to 6 minutes to sit back in a mindfulness or meditation skills and to train themselves with mindfulness and meditation skills. Very important point, which I would like to mention before I stop this recording. Even if you are diagnosed with ADHD, please don't take out the blue card of ADHD every time when there's a problem at work or in a relationship. Because ADHD, even though may be irreversible issue, it can be treated and coped with various strategies, whether with medicine management or therapy, with commitment and your hard work. Once again, I will say it was great to record this piece of recording for you. My coming videos will be more about treatment for the patients with ADHD and with bipolar disorder in a therapeutic way. So throw questions over me below my page of the channel of YouTube. We do have an email ID. Your identity will be kept confidential, and I'm surely going to reply to your questions by email, and they can also be kept confidential and be discussed in the coming talks. Till then, have a good life, and believe in that every problem has a solution apart from life and death. It is the only thing that maybe we may not find the solution to the problem the way we want, but the solutions are there. So we will try our level best to support you to find out solutions to your problems. Till then, have a good night, have a good day, have a good life.